There has been much confusion from experts whether wearing a face mask would help keep us safe from the novel coronavirus. This has not been helped by the president refusing to wear a mask. However, now there is no confusion with the Centers for Disease Control and Prevention official saying that the virus could be under control within a month or two if everyone wears a mask. Much of this confusion stems from the earliest days of the pandemic when personal protective equipment at hospitals was limited. At that point, people were told they didn't need to wear a mask simply because it was more important for those on the front lines to be wearing them. Additionally, while wearing a mask does help protect the wearer, more than that, it protects other people from the wearer. This was interpreted by many to mean it didn't matter if they wore a mask or not. Yet, COVID-19 is spinning out of control, and there needs to be a greater effort to prevent it from continuing to surge in different areas throughout the country. The time is now, said CDC Director Dr. Robert Redfield during an interview with Dr. Howard Bauchner of the Journal of the American Medical Association. I think if we could get everybody to wear a mask right now, I think in 4, 6, 8 weeks, we could bring this epidemic under control. Finally, the experts are all in agreement and saying the same thing. But the CDC and the World Health Organization, after 13 million people have been infected globally and at least 574,600 have died, now recommends that everyone wear masks to slow the spread of the virus. I think we're being very clear now, added Redfield. Now's the time to wear a mask. The spread of COVID-19 has been described by scientists as traveling through respiratory droplets from an infected person coughing or sneezing. Studies have shown masks may be a helpful barrier to the spread of these droplets. More controversial is research that suggests the virus could be spread through aerosolized droplets, especially in poorly ventilated spaces. The WHO acknowledged last week that airborne transmission could be possible in mostly closed spaces indoors, yet they believe more research is needed. If such transmission is possible, masks could be even more essential. On Tuesday, the CDC released a new study that said state leaders should consider making face coverings a requirement to reduce the spread of COVID-19. Offered up as evidence is 2 Missouri hairstylists who were infected with the virus but never passed it on to their clients. With the potential for pre-symptomatic and asymptomatic transmission, widespread adoption of policies requiring face coverings in public settings should be considered to reduce the impact and magnitude of additional waves of COVID-19, explained the study. Some governors required masks in public early on, while others have been a little late to the party now that they're trying to reduce the recent surge of the virus in their states, such as California Governor Gavin Newsom and Texas Governor Greg Abbott. Florida Governor Ron DeSantis has left it up to cities and counties in his state to set mandates for masks. There is no nationwide mandate as in some other countries. Donald Trump criticized Dr. Anthony Fauci, the nation's top infectious disease expert and a member of the White House Coronavirus Task Force, as well as other health officials, for not advising that masks be worn at an earlier time in the pandemic. Trump said during an interview with Sean Hannity on Fox News on Thursday, "Dr. Fauci's a nice man, but he's made a lot of mistakes. They've been wrong about a lot of things, including face masks," explained the president. "Maybe they're wrong, maybe not. A lot of them said don't wear a mask, don't wear a mask. Now they're saying wear a mask. A lot of mistakes were made, a lot of mistakes." Trump wore a mask in public for the first time on Saturday while he visited Walter Reed National Military Medical Center. While the earlier advice of the health experts was confusing, the president not wearing a mask makes it that much more difficult to enforce. Trump also mentioned at one point that wearing a mask was being politically correct. Redfield said in the interview that wearing a mask is not a political issue but a public health one. He is pleased to now see Trump and Pence wearing masks in public.